Epilepsy is a neurological disorder characterized by recurrent seizures. Seizures are episodes of abnormal electrical activity in the brain that can cause a range of symptoms. Understanding seizures and knowing how to manage them is crucial for individuals living with epilepsy and their loved ones. In this guide, we will explore different types of seizures, their causes, the diagnosis process, and effective management strategies. Types of seizures. Epileptic seizures can be classified into different types based on their characteristics and the areas of the brain affected. The following are the most common types of seizures. Focal seizures. Focal seizures, also known as partial seizures, occur when abnormal electrical activity is limited to a specific area of the brain. These seizures can be further classified into two subtypes. Simple focal seizures. These seizures do not cause a loss of consciousness and typically last only a few seconds to a couple of minutes. Symptoms may include muscle twitches, sensory changes, or involuntary movements. Complex focal seizures. These seizures can cause a loss of awareness and may be accompanied by repetitive movements, confusion, or automatisms, repetitive behaviors. Generalized seizures. Generalized seizures involve abnormal electrical activity throughout the entire brain. They can be further divided into different subtypes. Absence seizures. These seizures are characterized by a brief loss of consciousness, usually lasting only a few seconds. The person may appear to be staring into space and may not respond to external stimuli. Tonic-clonic seizures, formerly known as grand mal seizures. These seizures cause a loss of consciousness, muscle rigidity, tonic phase, and convulsions, clonic phase. Tonic-clonic seizures often last for a few minutes and can be physically exhausting. Other generalized seizures. There are several other types of generalized seizures, including myoclonic seizures, brief muscle jerks, and atonic seizures, sudden loss of muscle tone. Causes of epilepsy. Epilepsy can have various causes, and in some cases, the cause may not be identified. Some common factors that can contribute to the development of epilepsy include genetic predisposition, brain injuries from accidents or trauma, brain infections such as meningitis or encephalitis, tumors or abnormal growths in the brain, stroke or other vascular disorders, developmental disorders such as autism or neurofibromatosis. Diagnosis and evaluation. Diagnosing epilepsy involves a comprehensive evaluation, including medical history, physical examination, and diagnostic tests. One of the key tests used to diagnose epilepsy is an electroencephalogram, EEG. An EEG measures the electrical activity of the brain and can help identify abnormal patterns associated with seizures. Additional tests, such as brain imaging with MRI or CT scans, may be conducted to identify any structural abnormalities in the brain. Managing seizures, anti-seizure medications. The primary treatment for epilepsy is anti-seizure medication. These medications work by stabilizing the electrical activity in the brain and reducing the frequency and severity of seizures. It is important for individuals with epilepsy to work closely with their healthcare provider to find the most effective medication and dosage regimen. Lifestyle and epilepsy. Adopting a healthy lifestyle can contribute to better seizure management. Some lifestyle factors that can help include Getting enough sleep. Lack of sleep can trigger seizures in some individuals. Establishing a regular sleep schedule and practicing good sleep hygiene can be beneficial. Maintaining a balanced diet. A nutritious diet can support overall brain health. Some individuals may find certain foods or dietary triggers that can worsen their seizures, and it is important to identify and avoid these triggers. Managing stress. Stress can be a seizure trigger for some people. Engaging in relaxation techniques such as deep breathing, meditation, or yoga can help reduce stress levels. Avoiding alcohol and recreational drugs. Alcohol and certain drugs can lower the seizure threshold and should be avoided by individuals with epilepsy. Seizure precautions. Individuals with epilepsy and their caregivers need to take certain precautions to ensure safety during seizures. Remove any nearby objects that could cause injury during a seizure. Ensure a safe environment by patting sharp corners or edges. Provide support during seizures to prevent the person from falling or hurting themselves. Time the duration of the seizure and seek medical help if it lasts longer than usual or if multiple seizures occur without recovery in between. First aid for seizure. Knowing how to respond during a seizure is important for providing immediate assistance. Here are some general guidelines for providing first aid during seizures. Stay calm and reassure the person during the seizure. Keep the person safe by removing any nearby objects and guiding them away from potential hazards. Do not restrain the person or try to stop their movements. Once the seizure is over, help the person into a comfortable position and provide reassurance. If the seizure lasts longer than usual or if the person experiences difficulty breathing, call for emergency medical assistance. Epilepsy awareness and support. Increasing awareness about epilepsy is crucial for reducing stigma and promoting understanding. Epilepsy support groups and organizations play a vital role in providing information, resources, and emotional support for individuals living with epilepsy and their families. Connecting with these groups can offer a sense of community and provide opportunities to learn from others who have similar experiences. In conclusion, epilepsy is a complex neurological disorder that requires proper understanding and management. By recognizing the different types of seizures, understanding the causes, seeking timely diagnosis, and following effective management strategies, individuals with epilepsy can lead fulfilling lives. With increased awareness and support, we can create a more inclusive society for those affected by epilepsy.